This episode is brought to you by One World Empowered. Hey there, tired mama. Do you wish you could push a reset button on your energy? Like, do you want to keep up with those Energizer bunnies that are running around you all day? I know. I feel ya. Coffee can only do so much. Well, don't you worry. I've got you covered. Now just imagine a community of mamas who know the struggle and are working together to harness and reclaim their energy. We're talking about a true community of mamas who get it. Daily practices to jumpstart your days, accountability partners, group coaching calls to ground and recenter you throughout the 28 days. Does this sound like the exact dose of medicine you need in order to feel 100% again? If so, this program is exactly what you need if you want to be more present with your kiddos, if you think a new routine will help you maximize your time and you enjoy having an accountability partner to help you with developing that new routine and those new habits, if you'd like to increase your patience and energy all while reducing your stress and anxiety, and if you think it would be amazing to have an understanding community of mamas who get it and are on the same path towards healing. Mama, today is the day you choose you and level up. Come join our 28-day energetic reset for moms by visiting www.oneworldempowered.com/workwithme and click the Learn More option next to the Energetic Reset program, or just scroll down and click the link in my show notes below. I can't wait to meet you and witness you step into your full potential. See you there, Mama. You're listening to the Empowered to Heal podcast. I'm your host, Dina T, and I'm so excited to take you on a journey through stories of everyday experts as we share the ways we've harnessed the power inside us to improve the quality of our lives and the health of our minds. We're so excited to have you here with us and hope you feel inspired and empowered to heal. Hello, you beautiful souls. I am joining you today from a place of awe. You see, I have this dear friend that I've known since I was like 14 years old. We were, I believe, freshmen in high school. And she's one of those friends who is super outgoing. She's got a personality that you can never miss. And she's super silly. She's like one of those movie buffs who can recite lines from movies like the best of them. And if you know her caring heart. You know her loving and helping nature and her genuine compassion for all living things, like literally all living things. She saves lizards and nurses them back to health. And she loves every form of art, and she has like this outgoing, bright, witty sense of humor. And she's somebody that you meet, and in an instant, you can sense her genuine nature, and you know more about her than what she's saying with her words. You become acutely aware that she loves with her heart on her sleeve and with all of the energy she has, and she feels things to an immense degree. I've known since like the moment I met her that she was destined for greatness. And I knew that there was a purpose behind why she was given the gift of loving and caring for others in such a thoughtful and intentional manner. She was so nurturing to every human being she met. And I remember back in high school, anytime I was ill or sick, she was like the mama bear that would come to the rescue to help you like just feel better by her presence. Oh, my Lanta. Well, I didn't know why she was given this beautiful gift until about 7 years ago, I would say. This beautiful human, my dear friend, her name is Lauren Tonge, although she will always be Lauren Malone to me, thanks to so many years of friendship and a lot of variations of nicknames of Malone. So about 7 years ago, Lauren's life was changed in a way that nobody could have imagined or predicted. She was pregnant with her sweet little baby boy, Riley, and she learned about halfway through her pregnancy that her baby boy had a congenital heart defect called Hypoplastic Left Heart Syndrome. Now, this meant that she was going to give birth to Riley. He was going to be born with only half of a heart and only the functioning of half of a heart. And in this episode today, Lauren is going to share about her journey through the diagnosis of this congenital heart defect in her pregnancy. She's going to share about her preparation for Riley's birth and his 3 open heart surgeries that he's had to have. And you can imagine that this would do a number on your emotional and your mental health as a parent. And that is exactly why I wanted to have Lauren on the show. Being an outsider, watching her story unfold over the years and seeing her strength and her resilience has just left me astounded and so curious as to how she's navigated in such an unimaginable experience, and yet how she can still continue to love and give and nurture and care for the world like she does. So today, Lauren's going to share the tools that she's used throughout her journey to nourish her soul and her mind and her sanity as she raises her medically complex son, especially during a pandemic. Hi there, Lauren. Thank you so much for joining us on the Empower to Heal podcast.
Thank you for inviting me. I'm so excited to join in this amazing project with you.
I literally when I started dreaming of this podcast and what I wanted it to be like, you were somebody that came to mind that I hope to interview. And I want to thank you for being willing and open to sharing about your journey because as an outsider looking in, you are truly one of the strongest mothers and humans I have ever met because you have overcome and triumphed so much in the face of difficulty and adversity and in a pandemic and
Yeah.
it's an honor to have you on here today and for you to
Well, thank
share.
you. I'm honored too.
So I remember, girl, you and I go way back to freshman year
High
of
school.
of high school. I think you were in my choir class
Yeah.
and you were so like this tiny little thing who was like so brave in her voice and talking and just being yourself. And I feel like I was on the opposite side of the spectrum of like this tiny little thing that was like meek and shy. And so well, at that point in our lives, we were so young, we became friends quickly through choir and drama and common friends.
Theater.
Yeah, we both
Mainly
kind of
theater.
abandoned the
Yeah.
choir crew and went to theater and drama. We go way back, and I wanted to bring you on the podcast today because you have a son who has hypoplastic left heart syndrome,
Yes, he
and
did.
I remember back in years ago when our shared friend Brooke, we were at like a pool party at her condo and you were pregnant with your baby boy Riley and you were glowing. You were so
I was
excited.
so excited.
But I remember that day you were telling me that you had an ultrasound and a scan for your baby boy and there was some like complications and concerns and they were
Hmm.
going to have to do more testing and I remember, it hadn't really sunk in at that point of what it could be, but it was just kind of like, "Hey, something's going on," right? And it may be right or not right. And later
Yeah.
you found out he's got a congenital heart defect, right? And he was going to be born. And so can you share with us a little bit about that journey? As an outsider looking in,
Yeah.
you were so brave and you were playing in the pool and chatting and you were yourself, right? And man, just weeks later, your whole kind of
Yeah.
world's got the hardest message you could imagine.
Oh, it's still when I think back to the moments of when we did get a firm diagnosis of what he had, it definitely is still it's almost like a kick to the chest
Mm,
that feels like it happened just yesterday. And when I remember that day by by the pool, and I remember giving you guys this news, not sure how it would be met because I know that I was the first one out of our group of
mhm,
friends to become pregnant. And so all I know is that when I went in for my 20-week anatomy scan for my baby boy, which everybody does, I was on that table for
mm,
this ultrasound for an unusually long time. And they kept having me move from side to side, like, can you hold this position? I'm sorry, that's uncomfortable.
yeah,
And I remember just being kind of confused. And that dreaded moment of the doctor, well, not the doctor, I was actually the ultrasound technician. She put down the wand and she was telling me, I'll be right back. and that's when she went and talked to some people, and I'm left there in the room.
Gosh, that must have been terrifying.
Yeah, so I think I was by myself because Corey was still in the oil field at that time, so he was in North Dakota. So they came back in, very, very cheery, very normal, nothing different, and she told me that they were just having some trouble seeing a side of my son's heart, but not to
Mm.
worry because it was just probably the way that he was laying. So they're just going to refer me to a different doctor that has these certain tools that can look even closer than what they had, you know, for sitting on that table, the small of my back was just aching because of how long I was on that table. And I remember going to that pool party and I kind of knew that something wasn't quite right. I didn't know the
Yeah.
severity of it. I didn't know if it was right or if it was just the way he was laying. And I remember, I think one of the reasons why I was having the kind of, like happy, like normal Lauren's self was because I also do know that,
Yeah.
those negative feelings and stuff can really affect a baby, especially if
Yeah.
my baby was going to be a medically complex child, which thank goodness a lot of congenital heart defect children that are in the womb, as long as they're connected to mama's blood supply,
Mhm.
they're
Mhm.
stable.
Yeah. So you had this like crashing news. I remember this when we were at the pool, you didn't know yet what was going on, but a
No,
couple weeks later you
no.
did. You found out what had happened. And what was that like for you?
It's hard to describe this feeling into any kind of descriptive word. We were taken to do the ultrasound at a different place, and then we were seen by specialists at Phoenix Children's Hospital, and that's when they sat me and my husband down, and also my parents and
Mm.
my husband's parents, so grandparents, and that is when they delivered the news that there was something wrong with his
Oh
heart.
God.
And not only was there something wrong with his heart, but he was incompatible with life.
So you hear that and you're like, my baby's gonna die. Like, my baby's not gonna make it.
It was so many. I was hearing all these different words, hypoplastic left heart syndrome, congenital heart defect, all these different things. And as he's telling me this, I had to turn to my husband Corey and say, "Can you please hand me a trash can?" And I was trying not to vomit because it was so. Because as they're telling me all of this, I can feel Riley kicking.
Oh.
It just seemed to get more of a nightmare from there because as they're telling me this, they say you have three options. And I'm sorry, but I'm going to try really hard not to cry through this because this is
That's okay. It's
it's
okay.
a very difficult thing to explain. Um, and first of all and foremost, let me tell you that the doctor that gave us this news, he was just so kind. Everybody at Phoenix Children's Hospital is so family oriented, child oriented, feeling oriented. And he was explaining to me that I had three options: late term abortion. Now, I know that that is a really
Yeah.
hot topic right now. I know there are a lot of really strong feelings about that. But in relation to that, I, for people that don't quite understand late term abortion, it's for the
Yeah.
babies that are born into pain, the babies that
Yeah.
are born into sickness. So it is that family's and that mother's decision whether or not to go with a late term abortion. Because until you've seen it firsthand and how
Yeah.
scarring it is to witness,
Yeah.
the late term abortion kind of, it doesn't, people don't quite understand.
I would agree with that. Like, I feel like there's like this
Yeah.
perception of you don't want your kid. And it's like, no, no, it's not that at all. I want my baby. I want my baby healthy and I don't want them to die in pain. Like,
Well, another thing is there's a lot of mothers where that child's certain
yeah.
illness or
Mm-hmm.
defect is going to end up killing the mother. So it's just there's so much in our community that there are many people that have healthy children. It's we would just like to invite everybody to take a look at some of the stories of the people that it affects. Anyways, let's get on to my three options. So I was given late term abortion, which once again, trying not to vomit into a trash can
Yeah.
because I can feel my son moving in me when I was given this option. This one, which I have known some families to do this. Second option was to take baby home and to allow baby to
Yeah.
pass in your arms.
Mm.
And that's something that no human being should ever have to do. And for anybody that has ever dealt with child loss at any stage, I don't care if you were 5 weeks along or if you gave a stillbirth. I see you, you are validated.
Mm.
And if I could hug you, I would. Because even with presented with the idea, it is a pain that I cannot
Yeah.
explain.
Yeah.
Our third option was aggressive surgical intervention. Now you hear those words associated with a newborn and you're thinking like, kind of wary about that, but we did our research. And this is what I can say to everybody listening that is faced with anything like this is do your research. And I'm not talking like Google. I'm talking about like published medical articles. And that is how through all of our research about all the different procedures that my son would be receiving, which was also a lot of our information support was given by Phoenix Children's Hospital. We learned that through surgical intervention, the possibility of a borderline normal life was possible. And the moment that they said that, it was not just a yes, it was a hell
Mhm.
yes. It was, let's put on our armor, let's do our research, let's know everything there is to
Mm.
know about this
Mm.
and get through it. And another thing that struck me during this information giving of my son's diagnosis, something that really let me know how serious this was, is that he said, your son has the most severe congenital heart defect that there is.
Mm.
Hypoplastic left heart, hypoplastic left heart syndrome essentially means that my son will be born with half a heart.
Oh my gosh.
And if he did not receive these surgical interventions within the first few days of life, his lungs will flood with blood and he will drown.
Oh.
It's really hard to look at. A lot of people want to look away.
Yeah.
A lot of people want to offer their condolences, but don't quite know how to respond. Sometimes I don't even know how to. But when we were, like I said, when we were given that third option, that's when we knew.
Yeah. You knew that you were gonna take that option. That was the one for you.
Yes. And this is another very helpful thing for anybody that's presented with something similar, anything medical, when you find out that somebody that you love is going to be medically complex, like I said, is doing your research and not just research on the actual illness, but research on the people who are giving you care.
Mhm.
Just because it's a hospital does not always mean that it's the best. We had to look at, and it is morbid, but we had to do this. We had to look into death rates. We had to look at survival rates. We had to look at the hospitals statistics, the doctors statistics, because all of this is public information online.
I remember driving down the freeway one morning and I was talking to you on the phone, and you were talking to me about the different hospital choices you had. And you settled on Phoenix Children's Hospital. But I remember you talking about, like, do we have to fly to another state? Will he have to be born in a certain hospital and then like take a helicopter air vac ride to another hospital for a surgery? If there's a complication, like, you had all of these options laid out in front of you that you had to understand what to do. And
Yeah.
thank God here in Arizona, we have Phoenix
Oh,
Children's Hospital. Like,
I am so thankful because we were looking into Boston Children's Hospital. There's Texas Children's Hospital. There's all these different leading hospitals that we were going to possibly be seeking care at.
so you had the opportunity to give birth at Phoenix Children's Hospital, right?
No, actually, it was because they actually don't allow any form of adult care except for in the heart center. And I don't know if any other center.
Okay.
I had to give birth at a different hospital. He was born, and then within the first day, he was taken by ambulance down the street to Phoenix Children's Hospital. So as I was recovering, my baby was at a different hospital than I.
Oh my gosh.
His well,
Oh.
we're getting a little ahead of ourselves too because his birth was interesting because they people always ask me if it while I was pregnant with him or while giving birth if that was dangerous for him. There's a lot of different congenital heart defect children where
Mhm.
usually in that process things at least for hypoplastic left heart children most of the time delivery is pretty straightforward, pretty normal because like I said as long as that baby is still connected to mommy's oxygenated blood supply, they're good. Even a few days after birth, they're still good, especially if they're given this certain medication that allows
Mhm.
the hole that is in between the two ventricles to remain open instead of closing like it normally would in a normal child. So if you leave that open, it allows a little bit more wiggle room to get them to surgery.
Okay.
Yeah, Riley's birth was really rough. It was 27 hours of labor and cord wrapped around the neck, which everybody, that everybody, when they hear that, it's a very scary thing. But actually, having the cord wrapped around the baby's neck is actually pretty common.
Mhm.
But it happened to him to where it was difficult for him to descend. So it was a very difficult birth. So he had to have an emergency, well, not an emergency, but an intubation right after birth just to make sure that he didn't breathe anything in because of how long he was in the birth canal for. But he was stable after birth though, and we got to hold him.
Mm.
That was dreamlike. I have a video of him that I still watch of one of the first times of him opening up his eyes.
Mm.
And he had like these sparkly, sparkly dark blue eyes where you could barely even see the whites of his eyes. It was all just this bright blue color. And so there's these little things that I try to hold on to.
And I wanna just comment for a second, like, you getting to hold your baby, like, normally, that was going to be a moment that a fleeting moment because then he was gonna go into surgery, and for a huge chunk of his infancy, he wasn't in a condition where you could just snuggle up, like
Oh, no. No, not at all. He was, before he had the surgeries, he was still difficult to hold because he had to have all kinds of leads on him,
Mm.
monitoring all kinds of different things because the reality of having a cardiac child, especially at a time like this, is that things can change in a blink of an eye.
Mhm.
So, before his surgeries, another thing, like you said, when I was holding him in that fleeting moment, is that this is one of the last days that I will hold my boy without him having him touched by a knife.
Yeah. Like the pure perfect little boy that you created, like, in his ugh.
I was touching his chest and I
Aw.
was just really trying to give him all the connective and touch that I
Mm.
could. So he was very stable throughout the first 5 days, which he received his first surgery on the fifth day. But up until then, you could tell he was lethargic. He couldn't breastfeed, which broke my heart because it is definitely it's different for every child with a congenital heart defect. I've heard of some babies being able to breastfeed just fine. So when I saw that my son, he just watching a newborn baby be hungry, but not able to eat and not even have the energy to let you know that he's hungry, That's unsettling as a new mother. That's hard. That was hard to experience. And to feel as a failure, even though logically I knew that,
Mm.
it wasn't anything in my doing. It's ingrained in you as a mother. Speaking for myself at least, that I just,
Mm.
I couldn't give this thing that was going to help
Yeah.
my baby, and I was pumping, and
Yeah.
then my milk supply went away after a
Yep.
few weeks because of the
Yep.
stress, and I got shamed. I got shamed for
Oh.
that.
I wanna say, like, the psychological effects of this for you as a mother is that's what's astounding for me is how you've navigated that. Like, I'm sitting here listening to you and having moments of, like, tears rolling down my cheeks because you bring your baby into this world and you want everything perfect and beautiful and wonderful and safe for your baby. And to know that you're birthing your baby and that in the first few days of life, he's going to undergo his first open heart surgery and the risks associated to that and the pain for your little baby associated to that, the connection and the nurturing and the bond that you're creating with him and how that's influenced and affected and your sense of like a lack of control like all of these things, I hear this as you're talking about your story, and my heart is just I mean, I've seen you go through this as an outsider. I've seen you visited you in the hospital as you're putting on a smile.
Yeah, you did.
I've been
Yeah.
I've been I've seen pieces of this as you've gone through your journey, but I've always seen you on the outside as an advocate and as somebody who's so strong, screaming on the tops of the roof saying, "This is what you can do. This is what I believe in. This is how you can help your babies. We're doing this." And prayers for my baby and look how strong my baby is and like you found this way to be an advocate and a cheerleader and a beacon of strength amidst your darkest hours and your hardest most painful hours of your life and holy moly like
It definitely leaves its mark, especially speaking with motherhood. I have some different family members that, almost get annoyed if I fuss over if my children are like maybe sick or hurt, or like, oh, let them get hurt, and it's oh, they're just growing up, they need to get, don't hover over them. And I kind of it's difficult because it's ingrained in my brain from the moment that I came into motherhood. I hit the ground battling, running.
mhm
And so when now I am in these honeymoon years where everything is well monitored and that
yes
he's now doing
yes
so well, I still do have those moments where I do have reactions that where people are kind of like, "Oh my gosh, like calm down." And you're kind of like, "Oh, you don't quite understand what I've witnessed."
yeah
But
you're programmed in a way that your body like whew,
and that's what I have to try to unprogram, because there are times when, yes, of course, listen to your mama bear instincts, but there are other times where it is a negative influence on your child that will
mhm
make
oh
them
yeah
worry. That is something that I've had to
I
battle
want to
with.
speak about that for a minute, Lauren. There's
Mhm,
effects as a psychological effects going through something so traumatic as this. And I know you've shared about your diagnosis of post traumatic stress disorder, PTSD. And a lot of people hear this diagnosis in terms of like
mhm,
war and battles and surviving war
mhm.
and battles. And for you, it was surviving watching your son have open heart surgery multiple times, watching your son code in front of you and people rush in to save his life. Like you have
Yeah.
all of these moments where that's ingrained to you. And then you see your son and your baby's having a beautiful time, like doing well, and you hear a cough, and all of a sudden your head goes back. It goes back to, oh my God, my baby when he coded and everyone had to run in. And
Oh, there's so many different. There are times when you are strong, and there can be moments in everyday life that can mirror or remind you of past traumatic events, and you can brush it off and say, I am here in the now. But there are some things that will catch you so off guard that it literally brings you to your
mm,
knees shaking and trying not to vomit. So it really is a balance, and there are a lot of times when you think that you might have your PTSD under control, and that's great, but there are times
Yes.
when you will have an
Yes.
episode, and that's okay because that's really part of the process. It's never what you and I were talking about before
Mhm.
this. It's not getting over your trauma because it's just going to be with you always. And you have to learn to cope with it. I mean, we're talking about, the trauma associated with my motherhood and trying to balance that. At 5 days old, my son had aggressive open heart surgery where when he came out of the OR, he had a little piece of plastic over his chest incision. And I leaned over my boy and I saw like a little butterfly in his chest. And I looked at the doctors and the nurses and I said, "Is that his
Mm.
heart?" And they said,
You
"That's
could
his
see
heart."
it?
I could see it
Oh.
through the film
Oh.
because and some people might be like, "Oh no, that's not possible, blah blah blah." But what you have to understand is that you actually want that because if you close the chest too soon, there can be building
Oh.
pressures and that is very dangerous. I've heard a lot of families where they close the chest, then had to emergency open the chest, and then close the chest, and then
Yeah.
open it.
So it was intentional.
Yes, it is intentional. It is graphic as all get out.
Yeah.
These are the different examples through my beginnings of motherhood with my son Riley. The first event that really struck me, that is a mark on me, at that 5 day old Norwood procedure, which is what they call it. So I got to see my
Mm.
newborn's heart like open.
Oh my
And
god.
this is one of the ways that I learned to cope with this. All of this imagery, all of this is, once again, do your research, know why these things are being done, know what certain things mean. When I learned about the building pressures in the chest, the opening of his chest was not as scary. It was actually, okay, he's in a sterile environment. This is how it's supposed to be. That was one of my most empowering tools, even through the very beginnings before he was even born. One of my most empowering and coping
Mm.
tools was to do my research and learn what I needed to learn.
Yeah.
So they told us that after the Norwood procedure, this is the most dangerous procedure. It has the highest mortality rate. I am happy that I have Phoenix Children's Hospital under my belt because their statistics are
Mm.
a much higher
Mm.
survival rate than some other hospitals. So my son received his open heart surgery, and these surgeries, in essence, are supposed to basically reroute
God.
his blood supply so that one side of his heart can do what it
Mm.
needs to do for both sides of his
Okay.
heart, which is why it has to be done in a series of three because it has to stretch that repair as the heart grows. Does that make
Yeah, so
sense?
in my brain, I always pictured it as they, like, built the other side of your son's heart, but really they helped your son's heart do the function that it
No,
should.
yeah. Yeah, if anybody is so inclined to look it up, it really is like rerouting some like hoses and different things like that. And to know the statistics of the surgery that my son just went through, I knew what we were up against. There's lots of other families on this floor of Phoenix Children's Hospital of the CVICU, the cardiovascular intensive care unit. So you see all these different families along all walks of life on different areas of this journey. I was in the very beginning of mine. As I was sitting next to my son's little glass bed and me not allowed to
Yeah.
touch him while he was in a medically induced
Oh.
coma with morphine and had more medicines going into him than I have ever seen anybody receive, even in movies.
Mm.
And as I'm sitting there, this is something that really struck me as a little boy that is now Riley's age, so like 5 or 6. He had a patching over his chest and he was walking with an IV and he was whimpering as he was walking because he just received his Fontan procedure a few days before, which is the third procedure. And this boy who just had open heart surgery was up and walking around and it just, I remember that was one of the very first moments where I saw these cardiac kids for what they really were. Remember looking at that and thinking, okay, it looks like it doesn't get much easier from here, but it is so worth it. Because
Oh
I
my
remember just
gosh.
looking at that boy and just thinking of how beautiful he was and how well he was doing with each step he was taking. And it's little things like that that you really have to hope for and you have to focus on. And when your mind does go to a dark place, you have to think back on those
I
things.
love the
And
visual you just painted. I keep, like, choking back tears of, like,
well,
oh.
it's hard. It's hard seeing a person who is very ill, but to see it on a
And
child,
to see the strength, like, not just the pain and the hurt, but the strength, like, oh my
that's
gosh.
exactly what I mean. I'm a grown adult, and if I just had open heart surgery and you told me that I needed to get up and walk around, I'd be like, "You're crazy."
Oh, I can relate to that.
Did my research. Yes, you can. Yes, you can. So one of my
Uh,
first moments of trauma of something that happened that was not supposed to happen, that was not planned, that was something that I was not able to really prepare for. One of the first scary medical events that happened with him is right after the Norwood procedure, which is the first one where he, out of nowhere, he woke up out of his sleep screaming very
mm,
unnaturally of a newborn. It was never "I'm hungry." It was never it wasn't the normal newborn cry.
yeah. Yeah, you could
It was
tell something was wrong.
excruciating scream.
Oh
And this was in the middle of the night. I was asleep, still trying to recover from my extremely rough delivery on a hospital bench bed, and my
gosh. Yeah.
husband, Corey, asleep in a chair, awoken to the sound of my newborn just I'll never forget that sound and all of the alarms, all of them just going off. And at this
Oh
time,
god.
I was still learning what these alarms meant. When I saw how many people came in, they took the wires that were still, they had some wires that were connected to my son's heart through his chest that was surgically
Mhm.
implanted specifically for this reason. He was thrown into something called an arrhythmia. So his heart was going boom, 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 boom,
Oh.
boom, boom, boom. And we noticed that he had a little bit of a temperature earlier that evening. He was really,
Uh-huh.
really sweaty. And we didn't know that these were symptoms of what was to come. And it actually is pretty common because they call the first little bit after the Norwood is the honeymoon phase where things are quiet, but then things can start to go awry from there. And that's why it's
Mhm.
dangerous. So we experienced that, and they connected his heart to a little machine that would shock his heart back into a regular rhythm. And they were actually able to get that under control.
Mhm.
That was one of the first moments where I was like, he could have coded. We could have lost him. We could have been like that family 3 doors down from me that I heard 10 hours earlier screaming because their child just died. But once again, in moments like that, even in the chaos, you have to think back to that little 5-year-old boy doing his rounds around the cardiovascular intensive care units. So
Oh gosh.
that's an example of when you have to bring yourself back to certain things. I would have to bring myself back to that little boy. Something that we were told by the doctors early on was do not compare your child's diagnosis to another child that has the same diagnosis, because that's the weird thing about heart defects is that every child handles them so differently. The same defect can have a slightly different anatomy than another same defect. It's all very complicated. So to see all these different families on all these different levels of struggle, you would see the child being discharged going home with balloons and the families lining the hallways clapping. And then you see the cleaning
Oh
part,
my god.
like leaving the kid's room next to you, and you heard all of it the night before. But
Oh
that's
my
just
gosh,
it, is
Lauren.
that this is really hard to hear, but One of the things with coping is focusing on your bubble, focusing on your story, focusing on your boy's care, because if you focus on everything around you, you'll go crazy. So that was one of my
Yeah.
first moments that marked me. We got through the that procedure. We had to wean from narcotics. We had to give him
Mm.
things like Ativan, which is a highly addictive anti-anxiety medication. All of these we had to wean him off of, and I had to witness my 1-month-old son go through withdrawals.
Oh, oh my
He would
goodness,
vomit, he
Lauren.
would shake, he would cry, he wouldn't eat. We had to take it down millimeter by millimeter, day by day. We had to literally start taking 1 millimeter away every 5 days because he was so sensitive to being weaned down from these medications. So, and both
Mm.
Corey and I had to give these different medications to him 12 times a day.
So, tell me this, how old was he when he first went home?
That's right. He got discharged home, to go home. Honestly, I can't tell you how old he was because that was one of the most difficult times in my life, and there are certain aspects that I didn't really quite pay attention to because I was so
Yeah.
immersed into everything else. I know that we were in the hospital for months after the Norwood. It also is a bit of a blur because we were discharged home all the way up until the Glenn procedure, which was the second open heart surgery that he would receive,
And how old was he for that one?
5 months. So between being discharged home from being a newborn or a few, like 1 month old, 2 month old to 5 months old, we were back and forth to the hospital more times than I could count
Yeah.
with the alarms blaring in the back of the car while one of us sat with him while his blood oxygen was just
Oh, I
plummeting.
remember you describing, like, ambulance rides and car rides where he was purple and blue and gray and different shades as his heart wasn't pumping correctly. He wasn't getting what he needed to live.
Yeah, it was, and more things would happen the more that we went on, to the point to where I fought with them to get him admitted because it was so bad to the point right up before his 5 month. And I'll explain this is because so the Norwood repair is starting to not work as well because it is being stretched
Okay.
because he's growing. It is not able to do what it needs to do. They try to put off surgery as long as you can,
Okay.
but also not to the point to where it's detrimental to their
Mhm.
like health. As this repair was slowly starting to not work as well, we were starting to see symptoms. And one of the ones that scared me the most was the perfusion to his gut, to his stomach. So the blood flow to his gut was so decreased that he couldn't digest food
Oh,
anymore. We would give him formula because my supply dried up
yeah.
because of stress. So we were giving him formula, and he would take it through his NG tube. So he would not take any food by mouth at this point. It was through a tube that went through his nose down into his stomach.
Okay.
After he would eat, then he would vomit, and it would just be like yellow sand. And I never understood the texture until I realized what the texture of formula is before it's mixed.
Oh.
And I realized that's what it was. And that's when we were like, okay, it's time for the Glen. And that's when the doctors were like, yeah, let's do this. We can't keep nutrition in him. His limbs, he's cyanotic, which means he has really dusky blue undertones, in his nails, his
Mm.
lips, his feet, his hands, especially when he gets upset. When a cardiac child would get upset, a lot of their limbs
Mm.
turn blue and their lips turn blue. So once again, I had to hand my child over to a surgeon, and I'll talk about that surgeon in the end. And each time that he goes under this, they do a technique during these surgeries, which is where they bring his body temperature down to the point to where his heart stops.
Whoa.
Yeah. And then after the surgery, they restart his heart. And sometimes all the doctors have to do is just gently squeeze it between their thumb and their forefinger.
Oh.
Oh man, wow. Sorry, I just forgot that memory.
No.
Sorry, this is what happens when you
It's
talk about stuff
okay.
like
It's
this.
okay.
One of the first things that the doctor said to me, the surgeon said to me when he came out of the OR from the first surgery, was that they didn't even have to shock his heart. His heart just started beating on its own.
Oh,
I'm sorry.
it's okay.
So just to hear, and that's what I mean by the little things, is
Yeah.
little things like that in the really dark moments, you have to bring that to the forefront. I know that some people might think like, "Oh, wow, that's really great that you can do that. That's like something that you should be really proud of." But what you don't understand is that when it's your child, like you have to
Yeah.
find a way. Like you have to find a way to stay his advocate, to stay present, to see the ugly. So once again, another nod to the little things.
Yes.
They're little things, but big things.
Mm.
So, like I said, once again, I had to deliver my child into the arms of this surgeon. He comes out of the surgery again. It wasn't as graphic as the first one, but it was hard because each different one of these surgeries or events are difficult for different reasons and yet the same reasons. This time it was significantly more difficult because we knew him. We knew his
Yeah.
personality. We knew we knew how cheeky he was and how he would flirt and how, how he would love clapping and just all these different things. And so it's seeing that once rambunctious little boy be completely just in a medically induced coma, but he's like they woke him up just a little bit and it just the wails of
Oh.
pain, and he would just his little hand would grip my hand and leave fingernail marks in it.
Oh.
And that was us trying to figure out an appropriate, gosh, what's the word that I'm looking
Like
for?
dosage?
Pain management. Pain management after surgery, as you know, you always have to try to find that magic care
Yeah.
program that helps with that care. And with this kind of procedure and having a child that can't even talk to you is there all in of itself. And may I also say that the nurses, oh my God, the nurses might as well have been one of my children's aunts or uncles. And I'm not even kidding.
Mm.
I would go down to eat lunch and I'd come back up into the room and I would have one of the nurses sitting there singing to him.
Oh, that's beautiful.
And my husband and I said that we never associate Phoenix Children's Hospital necessarily with all this trauma, that we continually see it as a place of hope and
Mm.
healing because it's a safe place. Even though scary things happen there, it is a place of
And
hope.
that's one of the most important things that we need as human beings as we go through hard stuff, right? We need somebody,
Yeah.
a safe person, like you said it perfectly, a safe person. And the fact that that was the nurses that you could trust, like whoever was on rotation, right? Being the same safe beacon
Yeah,
of hope.
it seriously did
Yeah.
not matter who was on rotation. I mean, there were some nurses where I was just like, "Oh my God, I can sleep through the night because I know that they got this because they know my son's every little like attitude."
Mhm. Mhm.
The nurses, everybody always claps for doctors and say the doctors saved the lives, which I agree. But those nurses, let me tell you,
Mm.
they are angels sent to earth. It takes a special person to be a nurse.
It does. And so, Lauren, you brought your baby back and he underwent the second surgery
Uh-huh.
and you're figuring out the pain management and what that looks like. And there complications with the second surgery as well?
This is where my biggest PTSD event happened.
Okay.
This is the big one. This is the one where I will try to get through it without crying to the point of not understanding me.
Yeah, and share what you want to share. I mean, what
And I am not ashamed also to cry though about this because that's what else I want people to understand. Showing emotion that is connected to trauma, don't ever shame anybody
mm,
for these emotions. And even sometimes that emotion can be anger.
mhm.
it's hard to navigate it all.
Yes, it is. Well said, my friend.
Thanks. So after his second surgery, he was doing really well. He was dealing with something called the Glen head, which is, once again, the repair was to reroute the blood, kind of help that repair a bit more. But now his blood was gravity fed, where it would pump up to his head and then trickle down his body, kind of thing.
Mm,
As someone that would receive it, you can experience headaches, or your head swelling.
okay.
And he experienced that a little bit, but he was a little fussy. And I'm like, okay, we know what this is. We identified it. He's fussy. I get it. I would be too. And I'm just trying to go through the normal walk of this that I did the first time. But we noticed that something wasn't right. He started to act really lethargic. His whole, just everything did a really quick 180.
Mm,
And then all of a sudden we noticed that he had a fever. And I'm thinking, like, oh God, please don't be an infection. Please don't be, I talking to lots of other families. Once again, you're not supposed to compare your story to other families, but sometimes you can't help it. So I'm thinking of all of these different things. Well, they did a nose swab and it came back as the
mm,
rhinovirus, which is the common cold. We didn't quite know what that meant for him because, like we said, everybody handles everything different. Now, I will also explain right now that this is exactly why I feel the way I do about the pandemic
mhm,
and the way that it is being handled.
mhm.
I have seen what a virus can do.
Yeah.
What I got to witness was scarily similar to COVID-19. So I'm living in my own personal nightmare right now, but we'll talk
Okay.
about that later.
Ugh.
He, over the next few days, it was just getting worse and worse. My husband and I started to take night shifts where one of us would go home and shower. And because at that point, Corey and I, we did not leave the hospital. We took showers because in his care room, because we were like a long hauler, they had showers and a toilet like separate for
Yeah.
each family. We said that we needed to focus on self-care and allow one of us to like go home, get like rest without being woken up by nurses every 20 minutes, getting a shower. Well, that was the first night that Corey was going to go home. And I was telling him how
Yeah.
scared I was. He was telling me, you can do this. You're a great mama bear. You know everything that's going on. And this is when Riley was very sick. So through the night, and this is in relation to COVID, he was, and we didn't quite know it at the time, his blood oxygen was just dropping.
Mhm.
He was taking a breath every 10 seconds, 20 seconds. And that's not, if you actually count out from 1 to 20, it's, and it was one of the most excruciating things to watch.
Yeah.
Um, your son's chest rise and
Oh.
fall and then pause. But
You're like, "Please rise again. Please rise again."
his blood oxygen was, it already normally ran in the mid 70s, high 60s. A healthy person is supposed to be at 100 or high 90s.
Yeah.
So basically, all night, I witnessed my son suffocating. And the doctors said that he was stable and that they can't do anything until it reaches a certain point. And we just had to monitor. And as a mom, over your little boy that's only 5 months old, and about every little bit, you wonder if that was the last breath that he was going to take.
Yeah.
So I'm sitting there, and the nurse is sitting across from me, and even the nurse, she just had this like super concerned look on her face. And her and I were just taking turns as to silencing the alarm because of his blood oxygen to to see if it would come back up, and then it would come back up and then it would go back down.
Mm.
I'm sorry, this next part is like one of the hardest parts for me.
It's okay, Lauren.
I remembered it that his blood oxygen went into the 40s. In talking with his doctors during his last procedure, they said, "Oh no, in his chart, he didn't hit the 40s, he hit the 20s." All of a sudden, as we're standing over my boy, it's like his whole body just went limp, and he turned like not blue, not purple, like he was gray. There was no color to him, and the nurse, I remember just looking at him and not knowing what to do. The nurse went over and she hit the big red button on the wall. And something that's really eerie that I still, these are certain things that are associated with my PTSD, is the sound of like 30 running feet. Like every single nurse and doctor that was on that floor came running into my boy's room. And they just, I mean, they hopped all over him, talking about things that I didn't even understand even after my research, and I felt lost. And as I'm looking at him, he was fading, and I was escorted out of
Oh,
the room
Lauren.
because they thought I was gonna faint. I can hear as they're taking me down the hallway, I can hear all of the alarms still going. I can hear them yelling things like suction, and then you called, Dina,
No.
because I was so distraught. I put up on Facebook what was going on, and you were the first person to call me.
Oh, baby.
So I was in the waiting room, and this is an example of coping. Your support system is make sure that you have a damn good support system, because I
Yeah.
don't know how I would have gotten through those few minutes without you. So I wanted to say thank
Oh, Lauren.
you. And Court, I love you
I love you
too.
so much.
Sorry, but so Corey, obviously, from the moment that he started to turn really bad, I called Corey, and Corey was, we're all the way in East Mesa, almost Apache Junction, and this is all the way in downtown
It takes a
Phoenix.
while.
I was all by myself. So they came back out and they said, he's alive, he's okay.
Ah.
What was happening is that he was laying down, and from all the mucus, I guess he was trying to vomit it back up, but he wasn't strong enough and it was blocking his airways. And the moment they tilted him up, I guess yeah. And
It came out.
that was the suction, and they had to do an emergency intubation on him. So they warned me, they said he is intubated and he's stable for now. And that's the hard thing, is that a lot of these doctors, yes, they're caring and everything, but they can't sugarcoat, and I don't want it to be sugarcoated.
Yeah.
So to have a lot of different things, your worries followed up with your boy is fine for now. That's something that I still have to deal with to this day, is that your boy is fine
Mm.
for now. That is something that all heart patients deal with.
Yeah.
It's definitely something that you have to learn to live with and to have a healthy understanding of it, but at the same time, not be naive and not be aware of your job as a mother to be aware of what signs there are for your medically complex child.
Yeah.
When I went back in the room, he even had vomit on his eyelashes. Like, that's how bad it was. So,
Oh. Oh, baby.
and this was all from the cold.
And here you are in the middle of a pandemic, Lauren,
Yeah.
like, holy bananas. Like, we're in the middle of a pandemic and you're having these flashbacks, right? These worries, these fears of like my baby almost died because of a virus and given his medical condition. And now in Arizona, mind you, at this point in time, COVID-19 is killing many, many, many people in Arizona. We are a hot spot. And you're on like house arrest with your babies to keep them safe because you're like, hell no, like, not my baby, not my baby.
It's really hard to keep a level head nowadays, and yes, he recovered from the virus. He was able to be I have the most beautiful, just absolutely beautiful video of him right before he's extubated. So they woke him up out of his coma and they were coming in to remove the tube, and he opened his eyes and he looked at me.
Oh,
I was talking to him and he was talking with his eyes. He's very expressive with his eyes, and I could tell that he was just so happy that I was there and that he was here. And it was, once again, little things, even though through that absolutely horrible experience, my boy woke up and got to look at me and hear me say, I love you,
yeah,
and that I'm proud of him.
yeah.
So this is what bothers me about this COVID thing, is there's so many that
Mm,
don't get that chance and that they die alone. So I've seen what a virus can do, and to know that these people that are connected to these ventilators have to pass alone, it is physically painful for me
yeah,
to think
yeah,
about. And that is something that I have to navigate day by day as I see people with all kinds of opinions, but their lives have never been touched by it's so graphic. It's just
I hear you. I think that's an important message too. Like, we're in a world where the pandemic has been viewed and made as political, and
yes.
mask wearing and social distancing has been made political, and the reality is some people get it and they do great, and then there's some people who get it and they
It's Russian
don't, and they
roulette.
die, or it causes major complications. Yeah, great. That's a great example
Or the
of
people that
whatever
are
you call that.
asymptomatic and then about
Huh.
6 months later suddenly are in heart failure because the virus attacked their heart unbeknownst to them until they started having heart problems. And now they are in conjunctive heart failure. So there's all kinds of stuff about
Yeah.
this virus.
And that's something I want to spend a minute, Lauren, talking about that through your eyes, because I know,
Mhm.
I know you. I know your strength. I see your strength. And I see and I know your anxiety and your trauma. And amidst a pandemic, in isolation,
Yeah.
right? Separated from the people that comfort you and you need the most, in a land where you want your babies to experience all the beautiful things, because heck, your baby survived 3 open heart surgeries and you want him to make friends and have fun and be able to play and learn. Like, you guys are on utter complete lockdown and isolation, and that has been torture
Yeah.
in so many ways. And torture not just because the isolation, but also torture because you're like, WTF, like, let's get through this already, people. Like, take it seriously so that we can, like, saddle up, mask up, get healthy, move on. And the smack in the face of people not taking it seriously when you're literally in isolation and lockdown to keep your
Yeah.
child alive. Like, there, how do you do it?
There are certain days where I certainly do not handle it well. There are other days where I almost remove myself to the point to where I'm just in the bubble of my house, and that's all that really exists. I'm not worrying about the pandemic or anything. But that's very difficult to do considering the symptoms that are associated with isolating. My son and my daughter and me, kind of my husband, but he gets to go to work. So, and I know he works with some cool people and stuff, but like we are in the house, and the level of frustration and anger that my son is displaying is worrisome. And I know why it's
Mhm,
happening.
mhm.
My son is actively going to some therapy sessions, because I don't want to. If I notice that my child is struggling mentally to cope with something that is a little bit out of his range of understanding, which I think a lot of children
Yeah.
are, it's difficult because I have to balance this. Listen, you're immunocompromised. I have to protect you as your mother. I have to, until we get a handle on this, until mama and daddy can be vaccinated. And it's always me telling him it's not always going to be like this.
Yeah.
That doesn't mean anything to him. All he knows is that he can't go to in-person school. He can't have play dates. He can't go to the park when there's like 25 other children. He can't see his cousins. He can't see grandparents. And it's difficult to hold firm in the eyes of the fact that my son is standing in front of me, literally crying because he wants some social interaction other than mama and sissy. There is no manual for that. I don't know how to handle any of this. He understands why, and it's something that we explain to them and we talk about often. I would really encourage that. I know that there's a lot of kind of like adult situations going on right now, but not talking to your child about it just leaves them in the dark with uncertainty. My son will actually
Yeah.
say something out of frustration about how he's frustrated that we can't go to the park. And without skipping a beat, my 3-year-old daughter will come up, pat him on the back, and say, "It's okay, brother. We will go after the coronavirus goes away." As anger and frustration inflicting as all of this is, especially for my children, and just absolutely gut wrenching. Just hearing your child say, "I really want to play with that little boy that's at that park." It is so unnatural in my motherhood mind to say, "No, don't go play with that child," because I am a child. I am a person that wants to teach my child inclusion.
Yeah.
And just the other day, we actually went to the park that's by our new house because there were no kids there. There was another child that came, and we didn't say like, "Oh, we're immunocompromised. You're not wearing a mask. You can't be over here." Like we didn't get our cell phones out and be like, "I'm recording this." We just walked into the field and played in the field instead because we are the immunocompromised family and we are the ones that have
Yeah.
to apparently make compromises, as I am continually reminded. This dad and this little girl,
Mm.
from like 30 feet away, they like wave to each other like, "Hello, neighbor," like social distancing. And this little girl started to walk towards Riley and Claire, and her daddy stopped her and said, "No, no, honey, we can't do that right now, and you know why." And the little girl started crying. The more and more that this is spreading, because it is so unchecked right now, we are seeing that, yes, it does affect children. And no, we do not know the long term
Mhm.
effects of this. So to see that when you
Mhm.
do have those moments, once again, the little things where you don't feel alone, where you see another parent have to get down on one knee and comfort their sobbing child because all they want is friendship.
Yeah.
And there's no manual for this.
But that's what you just described there is so validating. Like seeing another parent or hearing another parent and child going through a similar emotion and desire and
It is a lot.
loss. I'm going to call it a loss. Like that is so validating. Like
There's a lot of people arguing that we're taking their childhoods away. And I want to turn to them and be like, "No, no, you haven't seen anything close to that. This isn't a form of taking away their childhood. It's making sure that they have a healthy life." It's hard because
mhm.
there is a lot of divide in families right now over, like you said, everyone makes this political, and it's hard not to make it political when there is a certain political party that does illegitimize the severity and the dangers of COVID. So I can understand that, but at the same time, it
Yeah.
doesn't help anybody. I have gotten on social media where it was like a 12 news post about, some about masks and about the effectiveness of them. And I see all these different posts about all these people about burn all masks, they don't work, uh, all these different things. And I would comment with a picture of Riley after surgery, and I would kind of tell them, "Hi, I would like to maybe ask you to take a step into the lives of the people that this affects." And telling them about Riley's background and what I've seen a virus do that wasn't even COVID. And I got responses of that I am a libtard, that I'm a cunt, that I should get back in the kitchen and stop talking about stuff that I don't know about. I got told that it's not my responsibility to care for your sickly son. I have been told that they will pray for my son because of their medically unstable mother. Not medically, mentally unstable mother. I have been told that I should have let my son die. I have been told, oh, look, she's sharing a picture of her dead son. And then when someone came to my defense and said, no, that's a picture of her son recovering from surgery. He is now immunocompromised. That's what she's trying to tell you. And this guy was like, the only thing he took from that was, oh, apologies, her half dead son.
Mm.
And there's people that will say like, oh, social media, it's toxic, stay out of there. It is not. It's not just social media. I would go to the grocery store and there would be this man, and I'm not trying to stereotype. I'm literally telling you exactly what this man looked like, what he said to me, his mannerisms. He was walking down a grocery aisle. He didn't have a mask on, and neither did his wife. He was wearing a sleeveless Confederate flag t-shirt and wearing a hat that said fuck your feelings. So as he was coming down the aisle, he was talking very loudly and really projecting his voice. You know how there's some people where it's like you almost think that maybe they can't hear themselves because they're talking so loud.
Yeah.
So I'm thinking, okay, this guy is like, his breath is like really going out, like far, and I can't bring this home. So as I'm walking by this guy and my heart is starting to race, I'm starting to have anxiety, I'm starting to have PTSD type feelings starting to rise up. I guess I kind of visibly shrunk away from him, which I didn't even know that I did. He proceeds then to turn around and very loudly say, you don't have to worry about nothing, darling. I'm not sick. And he said, I'm right here. You don't have to worry about me. And he's laughing at me. I just wanted to turn to him and be like,
Mm.
you have no idea about my story. And that was just for me, just trying to get food.
Yeah.
But now we only do grocery, like pickup. So it's not just social media. I don't want to get off of social media because I don't use social media in the sense of that toxic way of using it. I use it to see my aunt's cat. I do it to see my cousin's birthday. I do it to see your little boy running around with bubbles. Especially someone who is as isolated as I am. And
It creates connection in the middle of isolation. Like,
so really trying once again to try to stick to your own bubble and not have other people's perceptions or opinions of something that is so personal to you. It's almost like they shame me for having these experiences with my son to have this opinion of this pandemic.
and I think it's important for you to share, like, you were telling me a
Yes.
little bit about statistics earlier today. Like, I think it's important for people to hear, like, you're not like a rare situation of somebody who's at risk of getting hurt during this pandemic. You're also not a rare individual of a situation where people are having to protect the lives of their child, or having an immunocompromised child, or having a child with a congenital heart defect. Like, this is very, very, very common, more common than people know. And can you shed light a little bit around the statistics that you had recently come across?
Here's a little look into the world of congenital heart defect. Now, in me telling you all of this, yes, we are immunocompromised, but what I want people to understand through the pandemic is that the number of people
Yeah.
that are being long haulers, which mean that they're sick for like 6 months or more, or that now have debilitating lifelong effects that are
Yeah.
going to be throughout the rest of their life. These are normal, healthy people that run like marathons and stuff. So people that have congenital heart defects, it's rough because This defect directly relates to your lungs and your ability to breathe and the amount of oxygen in your blood. So if you put on top of that a virus that is going to affect that, that is major danger zone.
And you were sharing with me like statistics around like how many people have congenital heart defects, right?
Yeah, so before I got my son's diagnosis, I had no idea about this world. No idea how big this community was,
Yeah.
had no idea how many it affects. Throughout the entire world, congenital heart defects are the most common birth defect. It is also the number one death causing birth defect. It happens, and this is when we started to hear the numbers where we were just like blown away. It is 60 times more prevalent than all childhood cancers combined. So that number is pretty staggering and eye-opening. I mean, one in 100 infants
Mhm.
are diagnosed with congenital heart defect, and 25% of those children will be considered critical and need intensive surgery, like my son had to receive.
Mm.
It's hard being a part of the congenital heart defect community. I mean, if you look at some of these statistics, it's, one is born every 15 minutes, and that there are approximately 100 to 200 newborn deaths that occur because there was an undiagnosed congenital heart defect.
Mm. So the point that you're making throughout all of this that I want everybody to hear crystal clear is how common this is and how every human being has a responsibility on this planet to think outside of themselves, right? Think outside of yourself and know that it is a fact. When you go even just to the grocery store, the people in that grocery store, there will be people in there that are dealing with this, that are trying to create safety around this. It could be intentional that they know about it. Maybe they don't even know about it. But the reality is you as a mama, Lauren, you are going through the world right now feeling unseen and invalidated. You are going through the world right now in a way where you're terrified regularly that your baby will be hurt indirectly because of the state of our world. And that's just because of the pandemic right now, like the added stress of the pandemic. I mean, you have these struggles pre-pandemic, right? And then you throw this on top of it. And so I want to make this point known. And I know that this episode is not about the pandemic, but I want to make the point known that we have like part of healing, part of moving through healing is feeling validated, being seen, feeling supported, right? And all of us in this world have an obligation and a responsibility to live our life in a way that is mindful and respectful of what's around us, right? We're all in harmony and synchronicity together in this universe, and that will create healing for other people, and that creates healing for ourselves.
Well, that's what you and I were talking about earlier, is that through all of my trials and tribulations, that receiving regular therapy with a therapist that you are comfortable with. I'm not talking about finding someone that sits you down on a couch and is like, and how does that make you feel? You have to find a therapist that feels like a family member, that feels like a friend. I see a therapist every other week. I am on antidepressants. I am on anti anxiety medication. I also partake in medical marijuana to help me with that. I will not
Mhm,
go into that because I know that there are some
mhm.
family members or others that will not agree with that. But when your doctor is continually trying to prescribe you highly addictive anti anxiety medication that makes you go cuckoo if you become addicted to it, I made the informed
Yeah.
decision. I did my research and I came to the conclusion of medical marijuana. It does help me significantly. It is no different than having a glass of wine
Yeah.
after the kids go to bed. One of the main points that I can say is that through me going through all of this and me hearing from my best friend that she didn't contact me through one of the hardest things that she's ever experienced because she didn't want to put more on me. Now, Dina, you and I have talked about this extensively, about how important it is to not give into that feeling that if you tell your problems to someone who loves you and supports you, that you are
Mhm.
burdening them. And it's so funny that I'm saying this because it's like take your own advice, but
And that's part of your identity, right? Like you're describing right now, like anybody who knows Lauren knows at any stage of the game of your life knows that you're a helper and you're a giver and you're a caretaker and you're a lover. You get and receive so much out of giving.
but there's also a flip side to that as well. There are quite a few people who have abandoned me as friends, acquaintances, or even family members, where they think that maybe I'm trying to get attention for my son's diagnosis. And I'm just like, no, I am just way damn proud that
Heck
I'm his mom.
yes.
I am damn proud. And not just of my son, my daughter too, and my husband. I'm proud of my family. So if you think me updating my family on how my son is doing is me trying to get attention, like, there's the door. There are people that I am I am loud. I talk a lot. I give a lot of love. I am too much for a lot of people. I feel too much for a lot of people. I have been put down
Mm,
on so many occasions for feeling emotions at the levels that I do.
mm,
I can't tell everybody how important it is to take a step back outside of yourselves. And has a different story.
mhm,
I feel like everybody should really try to strive to be the kind of person that, even though you're going through so much, someone whom you love is also going through their own form of trauma. You could be a huge piece to that puzzle of support and comfort and guidance to that person. I mean, of course, don't like push your opinion on them. We all need to be kinder to each other and ourselves. I'm still working on it myself. I can sit here and you might hear me say, like, oh, this is how I did it. This is what I used to help myself feel better. I also want everybody to know the messy side of it, the ugly side of it, the side that people don't want to talk about. To
mhm,
everybody, if you are having feelings of, suicide, of intrusive
mm,
thoughts, of severe
mm,
depression, anxiety, insomnia, I want us to get it out there that these are not extreme mistakes
yeah.
that everybody has to hide and pretend like they don't have. It's called the human existence. It's called self preservation. It's called personalities, moods. It's everyone's different. And I feel like everybody needs to be validated for that.
Let's practice human kindness.
Well, I feel like what all of this podcast is surrounded by and surrounded with my story is us as a race of human beings. We have to care for the vulnerable, the sickly, the sensitive, the broken down, the underdog, someone who's told that their basic existence is basically invalid because they don't have the same views, or my son is not worth saving because he was born with a congenital heart defect. It's just all of these different things of just human beings need to be more aware of
Mm,
all of the toxicity that is just ravaging us right now.
mm,
And this pandemic is so personal. Some people might like look at my page or certain posts or what I say or my opinions and roll their eyes. But I'm not going to be quiet. I'm not going to not say my opinion and then have someone call me a cunt and that be the end of it.
Go you, girlfriend. I love your spirit. I love your tenacity. I love that you're true to who you are and to be an advocate in this world amongst a very hurting society, right? And go you
Yeah.
for staying true to that. Like I wish I could freaking high five you right now.
High five through the phone.
Yeah. So Lauren, you're not the only person going through this right now. And I think this
No,
story and what you're sharing is a beacon of hope. I think it's validating for the stress that mothers, people, parents that are concerned and worried about the health of another person, how they feel like amongst this pandemic and also for the community that you're in.
we have to cherish and care for our vulnerable citizens. We have to care for our elders. We
Mhm.
have to care for the sickly. We have to care for the people that can't care for themselves. We have to care for the people that are healthy and then suddenly are not.
Yes.
It just really struck me the one time that I was trying to explain my story, and the only thing that this gentleman drew from it was that it was not his responsibility to care about my medically complex son.
Yes, it is. We are a community. Like,
I just want people to be aware enough.
mhm. And for those that are listening to this story right now, Lauren, and those that are compelled by what you're hearing, like I'd like you to share a little bit about like how can they be supportive of this community, or if they're in this community and they want to get connected to others in this community, how do they feel supported? Where do they go? What's been helpful for you?
Yeah, yeah, for sure. The one that I found that was really helpful, and they also even put on like little events. They're called Mended Little Hearts of Phoenix.
So Mended Little Hearts, is that on social media or how do people find that?
Mended Little Hearts of Phoenix on Facebook, and also Mended Little Hearts National Organization. It's a nonprofit support program for parents and children affected by congenital heart defect.
Mm, I love that. Thank you so much, Lauren. I appreciate you coming on the show and sharing your story and literally pouring your heart out about your son and your pride in your family.
I am honored that you had me on your show, and I am so proud to be a part of it, and I'm proud of you. And you say that you are impressed with me and proud of me, and the same goes for you because
Mm.
you and I are very kindred hearts, and the things that you have done in your life for those in need, I applaud you as well.
Thank you so much, my dear. Thank you for being on here. I appreciate you. Thank you so, so much for tuning in today. I hope you are feeling inspired and empowered in your own healing journey. I know that many of you listening might be reflecting on your own stories that you may feel called to share. If so, please reach out to me at dinat@empowertoheal.com. That's DENAT at empower, the number 2 heal.com. Or drop me a message through my Instagram handle at empower, the number 2 heal. I would love to connect with you and learn about your journeys so that we can hopefully continue to spread these powerful life lessons on empowering ourselves to heal. My contacts will also be linked in the show notes below so that you can easily find me. We are so eager to start a movement in showcasing the many ways we can heal. And you can be part of this movement too by capturing images and tagging them hashtag empower the number 2 heal on Instagram. We look forward to seeing all the ways that you are empowered to heal. I love you, beautiful souls, and thank you so, so much. Please be sure to subscribe, like, and review.